Doctor and paid the bill. There were no HMOs, no Medicaid, and little or no health insurance of any kind. These days, medical coverage dominates the healthcare scene, and so do overhead costs and government regulations. A new law in Florida aims to create options, as Capitol Update's Cody O'Hara reports.
Legislators on both sides of the aisle have agreed that out-of-control health care costs and a doctor shortage in the state need to be addressed. Representatives Danny Burgess and Mike Miller are trying to address that under House Bill 37.
There is a lot of people in the state of Florida that have come to me through the years as doctors and said, you know, we are worried about our relationship with our patients.
Doctors say they are spending too much time talking to insurance companies about diagnostic tests, what to code a charge for insurance costs, and other administrative tasks, and they are getting burnt out. This new law that goes into effect July 1st will allow physicians to enter into direct primary care agreements with their patients and cut insurance out of the equation.
And it says, I'm going to provide these services, and the patient will receive those services for whatever fee that might be. And it's not just for wealthy people. I mean, this is something that can be done by a doctor who says, I can afford to offer services at whatever price you can afford to pay.
Currently, across the United States, there's estimated to be over 4,400 direct primary care practices, and that number is only expected to dramatically increase. Physicians are expected to charge between $50 and $100 a month. That fee covers office visits, a physical, vaccines, x-rays, and more. It's up to the doctor to decide what they want to provide their patient under the agreements.
One size doesn't fit all in medicine. And I've tried to tell insurers and other people that we're not making toasters here. Everything's different. There are variables, and all that has to be taken into account.
Dr. Mancini is currently looking at becoming a direct primary care physician. For him, it's about having control over the decisions that are best for each patient.
A lot of times they come in here with their insurance. They don't know what's covered and what isn't, what they can do and what they can't do. And this way, it's spelled out directly. There's no unrealistic expectations on the part of the patient, and I think it would be much more efficient.
Marnie Jamison Carey, the executive director of the Association for Independent Doctors, she says as the state moves in the direction of direct primary care agreements, it will fortify doctors in their positions as the person in charge of their patients' care, instead of the insurance companies calling the shots. She calls them invaders.
DPC doctors and concierge medicine doctors, they can spend as much time as they want with the patient because there's nobody breathing down their neck with a blowtorch to them saying, you got to meet these numbers or you're not getting a contract next year. This is a bipartisan issue. And if you really tease the special interests out of the way, the only people who don't want this are the hospitals and the insurance companies.
The House passed the measure by a wide margin. The Senate passed it unanimously. Reporting in Winter Park for Capitol Update, I'm Cody O'Hara.